To me, psilocybin is a tool to ease suffering.
Hmm.
And psilocybin can be a very helpful treatment for those caught in a cyclic loop where they cannot find a way out and that they are limited in their day-to-day joy because of that loop. It can open up and pause the loop for just a short period of time, but just enough time to get out of that loop and have some light. And it's not pretty. It's not, I mean, snot's flying everywhere and, words are coming out that they would never say to anybody most of the time, but they need to come out.
Hello, and welcome back to Adventures to the Mind. This episode is an interview with Dr. J.J. Purcell, who wrote the book Psilocybin Therapy Understanding How to Use Nature's Psychedelics for Mental Health. Dr. Purcell is a naturopathic doctor with herbalism as her main trade, and she is also a psilocybin assisted therapy facilitator in Oregon. The interview is actually intended, I specifically geared the questions, the focus of the interview, to make this really introductory. I really wanted to create something with Dr. Purcell that could be a one-stop shop for getting the lay of the land as to what psilocybin is, what psilocybin assisted therapy is, what preparation is, what integration is, what the sessions can look like, things to watch out for, when to do it, when not to do it, how to find a trustworthy facilitator and what the risks might be. All of that is in this package geared towards people who are interested in getting that sort of baseline understanding. And I really liked Dr. Purcell's perspective, which is why I went for this style of interview, because I think through her naturopathic lens, she has helped create a really beautiful foundational understanding of psilocybin assisted therapy for you here today. And I'm excited to share it with you. Couple of points before we get into it. Number one, this was the last interview I shot on my old computer before it went like totally kaput. And so it struggled through this interview. Because of that, if you're watching this on video, yeah, it's not easy going. And there are a few jump cuts to correct for dropped calls and all that. I'm sure you'll adapt. It gets better about, halfway through, but that's just a little bit of a warning. And the other thing is that this episode was sponsored by Amentera, and you're going to hear an ad for them just after I finish talking here and just before the interview begins. And that's all for the intro. So this is episode 210 of Adventures to the Mind, an introductory primer on psilocybin therapy from a naturopathic perspective with Dr. J.J. Purcell. Enjoy. Thank you, Amentera, for sponsoring this episode. Amentera is a credible source for legal psychoactive plants and extracts, most notably the Amanita muscaria mushroom, the red mushroom with white spots that is often in folklore, Christian imagery, and old shamanic traditions. They do have other plants and extracts in various forms, extracts from plants like canna, from blue lotus, and others. So if you're curious about exploring any of these plants or extracts, head over to jameswjesso.com/Amentera and use the promo code ATTM22 for 22% off your first order. Dr. J.J. Purcell, welcome to Adventures Through the Mind.
Thank you for having me. I'm ready for an adventure.
Fingers crossed. So I got you on the show today to talk not so much about your book, but about the content of your book, Psilocybin Therapy, Understanding How to Use Nature's Psychedelics for Mental Health, which I really appreciate as what felt like a great sort of introductory text to thinking not just about the therapy itself, but sort of the larger context of understanding how it can fit into our lives, why and how we might move towards it, what are some things that we should consider, not just in how it might impact our lives, but how the larger sort of movement of psilocybin therapy, where it sits in sort of the history of psilocybin. So yeah, I really did appreciate it.
Thank you. Thank you. Yeah, definitely for those that are curious, dipping their toes, looking for answers about what it is and what it's all about. That's really what the book is geared toward.
Hmm. And something that I thought would be interesting is that it's pretty common here on the show that I tend to go to, I wouldn't say far out places, but I often make episodes and explore topics that anyone can get into, but they're rarely geared at the sort of like, I know almost nothing,
Hmm.
and I'm hoping this podcast will give me, someone who's like, oh, like I would like to have a better sense of what psilocybin therapy is, something they would have if they read your book, for example. I'd like to sort of pick your brain around that, with that in mind, like to create a conversation that works as a sort of way to get a better understanding of psilocybin, like a better beginner's friendly exploration of psilocybin therapy. Maybe also as like a sort of pre conversation warm up to them buying or reading your book. Um, and with that, I want to couch our questions in what initially drew me to your book, because turns out there's lots of stuff coming out about psilocybin therapy, and there's a big range of legitimacy around these things. There's also a big range of approach. A very legitimate sort of approach could also be in a very narrow window or a very specific window of looking at the thing. And what I liked about your approach is that you were coming at it as a naturopathic doctor.
Mm.
And so I would love to couch our conversation in a description of what naturopathic medicine is and
Hmm.
how it compares and contrasts to um, conventional Western medicine.
Sure. So, yeah, I'll take you on a kind of a rise and fall with that question.
Okay.
So, naturopathic medicine is been around for a very long time, but in the early 20th century, rise in medical anatomy and pharmaceutical compounds and such really changed the landscape of modern medicine to what it is today. So all of the more whole body approach type medicine was condemned, put to the wayside. Schools were no longer funded, and so that whole view of looking at the body from a everything is connected um, picture really disappeared, and we rose with Gray's Anatomy and all of this, cutting the body, looking at how things and systems function, compartmentalizing the body into very specific types, whether it's cardiovascular or respiratory or digestive, which is really great in a lot of ways, but it starts to miss the picture of how things are all tied together in most cases. So, a naturopath these days, you go to naturopathic accredited school, it's the exact same curriculum as an MD or an allopathic physician, but we have many more hours on top of that, which give us these tools. So that could be hydrotherapy, the use of water and healing. Great example is you sprain your ankle, using hot and cold alternatively. What that does is it vasoconstricts, vasodilates that area that's been injured, which brings blood flow, blood lymph, all of these healing agents to the area for expedient healing. It can be homeopathy, botanical medicine, manipulation, which is chiropractic, so on and so forth. So the great thing about a naturopath is we have this whole toolbox. So while we have the Western allopathic approach of diagnostic tools, we can then start pulling out different things from our toolbox to go on this journey with the patient to truly find the underlying root cause of what is happening versus just treating symptoms. And that's what drew me to naturopathic medicine is really it's investigative. It's very curious. There's deeper relationship with the patient because you're having to spend more time in conversation, in questioning, in trying certain things and seeing what works and seeing what doesn't work. So for me personally, when I got out of school, I focused my work on oncology care and on hospice work.
So oncology is cancer and hospice
Oncology
is
is
people who
cancer.
are palliative or basically on their way out of
Yes,
this
end of
mortal coil.
life.
Yeah.
Sorry, that's my daughter. I apologize. So end of life really is a very unique environment because uh, end of life patients are very open. Uh, they've reached a new plateau, so to speak, of where they are in their life, what that looks like for them, the questions they have, their emotional terrain. It's very rich. But it started to cross over into my regular naturopathic clinic patients. So I had a private clinic. I'd see patients. And pretty shortly out of school, I realized that we would spend about 10 or 15 minutes talking about physical symptoms and physical discomforts, and soon thereafter would start to move into mental health terrain. And that's where the bulk of my practice started to focus. What were people struggling with? Maybe it's not always this overt mental health picture, diagnoses of, depression, manic depression, OCD, anxiety. All of these things are present, of course, in some patients, but a lot of patients, it was this underlying condition of unhappiness leading to unwellness. And so I really started just to kind of jump into that, and that creates this really positive dynamic between physical health and mental health and whole wellness, which I found a lot of success in when we started to combine and really start taking away all the layers to figure out what was happening. So again, having all of these resources, having all of these tools to touch these different areas in a kind of a spectrum of treatment for me became a much more successful approach.
Hmm. And it would make sense, a person is a lot more than just what reads on their tests. And
Mhm.
even for myself, I could say that although perhaps a certain treatment might be the right treatment for
Right?
a particular condition that I might have, it oftentimes just being given the treatment is not effective in helping support the patterns of that are associated with the condition itself and the treatment, such that how is my relationship to the treatment and to myself with the condition going to come together to create the kind of beneficial results I'm looking for. And if I just go in and say, these are my symptoms, okay, this is your condition, and here is the treatment, you know, go, that
Right.
usually certainly isn't a complete picture. So it sounds like not only did you, does a naturopathic medicine practice invite you as the practitioner to sort of have a deeper understanding of your patient, but it asks the patient in a way to have a deeper understanding of themselves, and that these things
Yes.
combine sort of inform and feed the 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 healing journey from condition to resolution. Does that sound about
Yes.
right?
Very much. Very much. And let me just say I am not a counselor, psychologist, psychiatrist, and that's not something that I try to incorporate, with my patient, but it's just conversation. And a lot of times, pointing out or posing certain questions in a certain way allows for that inner reflection for the patient without pushing them as someone that's really trying to work on the whole wellness versus I'm not trying to mental therapy you,
Hmm. Hmm.
and so when you pose the questions that way in that kind of setting, it does allow for a lot of room And many times patients would come back and be like, I really thought about that question, and this is what happened, or this is what came up. And that would help to expose a really important point to lead to the correct treatment plan.
Hmm. With that kind of sort of the framework or the perspective or the worldview of naturopathic medicine kind of established and a kind of general understanding of how that practice for you as a doctor evolved over the course of your
Mhm.
time. Let's get into the kind of the bulk of the interview, the bulk of the content here, which has to do with psilocybin therapy. And starting again, asking you from your perspective through that lens of naturopathic medicine, jumping back and forth, like jump through to whatever perspective you need to explain it, but clarify if
Mhm.
you're leaning far out of your normal worldview to explain it in that way. But here's the most starter question, okay? What is psilocybin?
Mm. To me, psilocybin is a tool to ease suffering.
Hmm.
So, uh, I'm a little older. I grew up in the Dare era. I grew up with the commercials of the fried eggs in a pan and Nancy Reagan and all of those things that, were geared towards terrorizing anyone to try any mind altering or expanding drugs at the time. So psilocybin is much like any other medicinal tool that's out there. It's a compound that can be utilized and synthesized if needed. It's a medicine. Now it's been touted and treated and labeled as anything but that. So here we are now having this recognition that we do have this vital resource to help ease mental health suffering for some people. Now, I am not someone who says it's a one shoe fits all type of person. That would be very unnaturopathic of me because I, as a naturopath, know that I cannot give the same treatment over and over and over to everybody. We are all so innately unique that I have to look at each person, get to know them, and then find what's going to be the best. So for some, that can be psilocybin. And psilocybin can be a very helpful treatment for those caught in a cyclic loop where they cannot find a way out and that they are limited in their day to day joy because of that loop. It can open up and pause the loop for just a short period of time, but just enough time to get out of that loop and have some light for that person. So that's what I view as psilocybin.
Hmm. I'll jump in. I'll periodically add things that I think are important. If this is an absolute beginner entry for people, is that psilocybin is a chemical that comes
Mhm.
from predominantly a fungi, generally the psilocybe sort of genera of fungi, most often psilocybe cubensis or its various cultivars,
Yep.
periodically from some variations of paniolus mushrooms, and that it is a chemical that has a direct effect on the um, brain activity through predominantly the channel of a subset of serotonin receptors. Is that
Mhm.
correct so far?
That is correct. Perfect.
So then, uh, now I don't personally use the language of tool. I mean, periodically
Mhm.
I do because I am not of like absolute razor focus with exactly every word I use all the time,
Mhm.
exactly how I want it to say it every time. But generally, I don't personally use the language of tool. I have a more of an animistic view of the
Mhm.
mushrooms that psilocybin derives from. That might be redundant to say it that way, but uh, leaning in to the perspective of tool, unless you want to comment on that. I am curious now that we know what psilocybin is. You know, what is psilocybin therapy?
Mm. I'm trained in the Western model of psilocybin therapy. And let me backtrack. So, my personal experience with psilocybin therapy is probably what made me easily transition into this work now that we've come for full circle. So, my personal journeys with psilocybin were not from a clinical model, they're from a very different personal experience. But my training as a licensed psilocybin facilitator is in a very Western clinical model.
Hmm.
That being said, I've had many initiations and experiences in cultural uses of psilocybin, but I personally do not feel like uh, uh, I'm not from any particular lineage. I'm just a white girl from Nebraska. So that's where I work from predominantly. So, oh my gosh, I lost track. The question again?
It's okay. I don't know. Maybe it's not my place to say, but I don't see it. Don't, because I don't know you very well. But I reckon you're not just a white girl from Nebraska. Um, so the question was to, after my little sort of like eddy onto discussions
Yes.
about tool and animism, I was asking you, from your perspective as a psilocybin facilitator within the medical model, what is
Mhm.
psilocybin therapy?
Yeah. So psilocybin therapy is very much defined. I'm here in the state of Oregon, so we're the first, state in the United States to legalize this term, psilocybin therapy. And from a very regulatory definition, it is a 6 to 8 hour session where psilocybin is ingested, experienced, and that is that's it. So for me as a naturopath, what I do is I tend to have 2 to 3 sessions before a psilocybin session. The first one's usually geared towards questions. People have a lot of questions, particularly those who have no experience in this realm, and they could be fearful, they could just be curious, they could want to know every physical sensation. And that's where we start to educate a little bit, right? We don't know what's going to happen. That can elicit more fear because people really love to know what's going to happen before it happens. But these 3 sessions before are just dialogue, conversation. What does it look like on the day of a session? You come in at 8:30. We get comfortable in a really cozy, service center room because here in the state of Oregon, you can only do it, in a service center. So we have these, beautiful places that people can go and get comfortable. We walk the client to the dispensary. As the facilitator, I do not touch the medicine at all. Again, that's from the legal standpoint.
Interesting. Okay. Yeah.
I cannot touch it. The service worker prepares the psilocybin. And then we go back to the room. It's on a little tray. They ingest it. Then for, 30 to 45 minutes, that can look like a lot of different things. I personally love to do craniosacral just to help people relax, which is craniosacral is a biodynamic energy where you're just moving energy through the body to create a peaceful, balanced state. Some people like to bring a book, like whether a big art book or something that's personal, just to kind of look at pretty pictures or whatever it might be that we've discussed beforehand. And then typically the headphones go on if they're using headphones, or I prefer to pipe music into the room because I find headphones to be a little cumbersome, or particularly if you're trying to lay down, they get in the way. and then eye shades. And we have a lot of questions about, why are we using eye shades? Why are we darkening, this experience? And anyone who's done mushrooms in a social setting or in a personal setting, eyes open, it's wonderful. It's very social. It can be engaging. It can be very dynamic. You're experiencing the greater world. All of that is beautiful. But in this particular type of work, what we're trying to create is an interpersonal relationship. And when your eyes are not visually tracking stimuli around you, you have more of an opportunity to go into the internal terrain and experience more personal projections or experiences. And that's kind of what we're going for. Typically, sessions run, some people are done in 3 hours, some people are done in six. Again, circling back to that serotonin receptor sites, everyone is different. Some people are on SSRIs. That can usually indicate a much slower launch, can usually indicate a much higher dose needed for a session to launch. But then again, that makes a session last longer. Some people prefer to do a lemon tech, you know, to to get that launch a little bit faster,
To
but that
clarify,
can also
a lemon tech is a kind of extraction process that sort of makes it
yes.
so that the active alkaloids of the mushrooms hit sort of like faster, stronger. Yeah.
Right. Unfortunately, that can also lead to a greater quicker on the other side, which can be not pleasant for some people. It can drop off versus being this kind of easing up and down wave return. So a lot of the time is spent with someone in a comfortable state, whatever that means for them, on a bed, on a couch, in a blanket, moving, in a safe way. Um, my role as the facilitator is one, safety, just making sure that the client is safe. Two, if they've wanted me to record anything that they're saying or have said during a session, I'll make notes for them to return to later. Um, it can be comforting touch. All of that has been discussed beforehand. Could be a hand on the shoulder, a holding, of hand. It can be, giving a Kleenex if needed, these kinds of things. My role as a facilitator during a session is not to process. It's not to move into trying to understand or explain or help them understand or explain. All of that is for later. So my job is to basically quietly hold space for the person and make sure that they are safe. Um, Typically, towards the end of a session, if you've succeeded in launching, you will rise and fall. So you'll kind of come up to the surface of consciousness, and then you might go back down for a little while, and then you'll start to come up, and that's when you know things are shifting.
And when you say
And
surface
then
of consciousness, you mean sort of like you'll sort of come out of a sort of immersion in the
mhm,
psychoactive psychedelic effects of the mushroom. You'll kind of come out of it for this little island of sort of like,
mhm,
relative sobriety, and then you may dip back down. From my experience, the way I like to describe it is like waves. Often the first
yes.
waves are the biggest, but then they get kind of smaller and smaller until something, sort of it breaks against the shoreline and you're back to sobriety.
Perfect. Perfect. Yes, that's what it feels like, and that's you're more all of a sudden, you're aware that you're in a room,
Hmm.
or you might take a peek and then, put it back, and then yes, so those waves, get less and less as the medicine starts to process through the body, and then no more waves, and I don't like to say you're back to consciousness because you really aren't,
Right.
um, but you can tell yourself that just for an explanation
You've
at
returned
that point.
to sober shores.
Yes, you've
Yes.
returned to sober shores. I like that very much.
Hmm.
So, and then at the end of that session, we sit for a while. I'm just gauging, you know, and then at that point, one of two things happen. Where I see clients here in Portland, there's a hotel 2 blocks away. If this person is from out of town or if they've chosen to stay at the hotel, I typically walk them back to the hotel, and then they have a support person there for them. Otherwise, the support person meets us after the session to drive them wherever they're going and then to stay with them for the evening.
Hmm.
Feed them, hydrate them, just, not engage them. That's not the point of a support person. It's again just to be there to support that person and their needs for the evening.
Hmm. You have these sessions beforehand. A couple of things. One, I find it very interesting that in the state of interesting and kind of like, oh, that's nice, that in the state of Oregon, the description of what psilocybin therapy is so vague because it allows for a
Mhm.
lot of variations of practice. Um, so that was interesting. I could see why it was almost essential for you to describe how you provide psilocybin therapy, because if you were to just describe it according to the state legislation, that would have been a very quick and like end of conversation, basically. Um,
Mhm.
I when you talk about having these 3 sessions beforehand, what I hear you speaking to is what's often called preparation. That's about the
Mhm.
preparation for your journey. You're sort of helping the
Mhm.
person understand the mushrooms, understand their why, understand your facilitation, understand, is it a fit? Does it feel good? A building of interpersonal safety between you. You've got
Correct. That's
session,
huge.
right? You got session day, and then what of this thing called integration? What of this thing
Mhm.
afterwards, right? You said, your role on the day is not to sort of like help them understand what's happening. So a way that I think about it, it's like your role isn't to sort of like point them where they're supposed to go and tell them what they're supposed to process and then prescribe to them the sort of avenue and the methodology by which they're processing. You're actually just there to help them and the mushrooms, the psilocybin, like do what's going to happen in a way that sort of like holds a certain holds a certain edge on the thing so nobody gets hurt in the process. And then what of the moments that you're helping them understand what happened to them? Are these sessions that follow, and what is the point and purpose of those things, of those sessions, I mean?
Yeah. So, really great question. Integration, again, I'm an herbalist by nature. That's my background, and I used to say this all the time. If you get 20 herbalists in a room and you ask them one question, you will get 20 answers. And now this is the same for integration therapy. I feel like everyone has a very different opinion and thought and process about the matter. For me personally, I do think integration is important, and integration with another, I feel, is important. We, as humans, we're so good at figuring our own stuff out. So good that it's really easy to miss the mark
Mm,
sometimes. And so I do think it has the potential to be a greater healing when you have someone else to verbalize and work through whatever came up for you. So for me personally, my background is not, like I mentioned, psychology or psychiatry, and I don't have all of these amazing tools that some of my colleagues do. I don't. uh, I mean, some of my colleagues just are so, the modalities that they use for integration is more than I would be able to learn at this phase of my career. So what I prefer to do the day after a session, I always meet with the client. Preferably, it's in person because I think that's important. Some of these sessions can be a lot of emotional terrain brought up to the surface, and I think it's important to be there for them. So we'll meet for an hour or 2 or 3 if necessary just to kind of go through it. And what that means, go through it, is I'm listening to them now verbalize their experience. Again, it's never my job to tell them what they experienced, because then it wouldn't be their experience. That's if there's ever a modality that is interpersonal, it's psilocybin. And 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 for you to come to your own conclusions of what happened, I think is part of the process. That can be helpful, again, though, in having someone trained in integration or psychology modalities to help tease that out. So the first time after the session, we hang out, we talk, we decompress. I share notes if they had, wanted I've like some people just want me to transcribe. So, we go through that. They read it. They're like, talk through it. Then my preferences, and again, this is set up beforehand, is we've established an integrative therapist for a minimum of 3 sessions afterwards. Most of the time, this is someone's current therapist. My only recommendation and preference is that this therapist has tried and used psychedelics in the past.
I think that's a very fair stipulation. There are too many people that are proposing to do this work or support this work who have never had the
Yeah.
experience, and I think it's outrageous.
It's wild. I mean, even when I went and, got my post-grad certificate in the psychedelic training and research, I would say there was 60% of the class had never tried a psychedelic. And that's I just think if you don't have the knowledge of the terrain, it can be very challenging for the client to feel like they're, uh, being heard or that there's a non-judgment and that there's relatability. I think that could be really challenging. So I prefer to, if they don't have someone, I've got a great network of people all across the United States that I can connect them to. And then, we have the first session, the 3 of us have the first session. So, I'm their support, I'm the bridge, I basically am most of the time in the background unless some clarification is necessary or the client, turns to me and asks a very pointed question, then I can help. Um, and then I pass it off over to that. And that for me is, necessary. It's a requirement to come see me as a client, um, that this is established and that this is an agreement that they will have these sessions. Like I said, a minimum of 3. After that, I can't dictate, but, I think it's really, really important. And not even necessarily always to, like, tease through everything. Some people have, a real passion for therapy, and they love to dive in, and it's great, that's awesome. But sometimes it's just, in the darkness of the night, things come up, and I think it's important just to have someone checking in on that client just to make sure, um, that they've landed well and that they're okay, and, this is 2 weeks out, 4 weeks out, and 8 weeks out. That's really important, I think.
Hmm. Now, I believe I assume that when you said earlier, when you described psilocybin as I think you said something to the effect of it offers people an opportunity to get out of things that they're stuck in, or
Mhm,
um, there was a real sense that it doesn't do anything necessarily for you. It doesn't, in the sense of like, if I went in to see you, and I said, "Hey, like I'm feeling stuck in my life, and my mental health is in the it's subterranean. Like it's
mhm.
really poor." That you wouldn't say, "Oh, great. Well, mushrooms will change your life for you, and you'll be
God,
happy
no.
again." Right? It'll be something
No.
like, "Okay, this experience can maybe help you get a better sense of why that is the case, and support you in having a sort of a greater capacity to start making changes in your life, or engaging things in your life, such that you might start, moving on a journey of healing that you seem to be unable, or you perceive yourself as being unable to get past a certain plateau." And I'm jumbling a little bit here, but I believe I got from you is that the sense of it's something that offers an opportunity. It doesn't do anything for you in particular. So I'd love for you to expand a bit on that, and then contextualize um, where these integration sessions fit inside of this opportunity that
Mhm.
psilocybin can offer.
Sure. So, as I mentioned, no one knows what's gonna come up. You can have an intention. It can be very specific. You can have a trauma that occurred in your life that's really, holding you back. It can be a nondescript melancholy or depression that you have no cause, rhyme or reason. It can be, a lot of different reasons why people come. Now, what happens, of course, is we know that through these sessions, there is a happening occurring, and that can be most of the time, I would say, in my experience, there is a connection to self. That connection to self is, I think, the key that tends to happen. That can be compassion, understanding, the processing of a moment, um, key insight that they weren't able to recognize before. Um, but there is a, almost like a puzzle piece that gets moved into place for each of my clients that doesn't necessarily heal everything by any means, but it creates this awareness or this connection piece that they're then very, very curious about. And it's that curiosity that gets carried into these integration opportunities. Why did that come up? This is how I felt about it. And that feeling, this thing that came up, they could have also had an arc with the feeling. Could have been like misunderstanding to gradual understanding to compassion to process. There's so much happening in a session, it's hard to keep track. And so when you start to go to these integration sessions and talk about it, you remember things. You remember insights or feelings or images or uh, emotions. And that is this fertile terrain upon which to start talking about it. Um, one of my colleagues is really good at, gosh, I don't even know what the modality is. I should ask her what she calls it. But she has this um, box of scarves, and they're all different colors. So when someone says, I met my depression, you know, I in my session, my depression was standing in front of me, and we had a conversation. She's really good. She'll be like, "What color was the depression?" And the person will say, "Black or red." And she'll take out the scarf, and she's able to put it, use these scarves and colors and emotions to really help the person process whatever they experience in a way that really gives them deeper meaning and understanding upon which then to go forth. And so that's where I see that crossover.
Mm. So these integration sessions are really about getting a better understanding of all the things that seem to transpire and
Mhm.
how they may then apply in our lives afterwards, such that you can actually actualize the opportunities that that whatever it was that got processed or whatever it was that came up in the session,
Yeah.
to actualize it in our lives. So then it's more than an experience had; it's an opportunity made good on. I don't know if that's the best terminology, but an
Mhm.
opportunity made use of, such that it can actually create change in our lives, that we can use it to create change in our lives rather than it having just been an experience that happened that one time. Yeah.
Yeah, and that's great too. Um, I've just found time and time again that even if you go home and you journal about it or do art, which can be great too, there's something about the integrative talking component that creates this really amazing dynamic of potential investigation of what occurred.
Hmm. Something else that you said earlier was something to the effect of psilocybin is a tool to help alleviate suffering. I think it
Mhm.
was something to this effect. And
Mhm.
it's interesting terminology that I think I need you to better clarify, because if I think
Sure.
about something that's going to help alleviate suffering, I think I know what you mean, but I'm just going to try to condense it down to
Mhm.
almost characterize what I don't think you mean. Which is like, if I think about something that's going to alleviate suffering, my inclination is not to reach to mushrooms. My inclination is to reach to benzodiazepine, or to
Mhm.
like uh, a bottle of alcohol, right?
Mhm.
This things that do seemingly make acute pain go away.
Mhm.
In the way that I characterize that, I think there's a number of that characterization has a number of misunderstandings, perhaps. So what I'd love for you to do is to explain what you mean by it helps alleviate suffering in a
Sure.
discussion of the kind of things that can come up in a psilocybin session. Because it wouldn't appear to me that mushrooms are an all good feeling, thumbs up, hell of a time.
Correct.
And so when you say the alleviation of suffering, you
Mhm.
don't mean that they induce positive, good feeling
No.
experiences, right?
Correct.
Yeah.
Correct. No, that isn't what I mean. So, when I say alleviate suffering, to me, the mind, can be to me, the mind is what causes suffering for humans most of the time. It's our inability to not no, I'm gonna backtrack. It's our ability to create our own prison, to create our own, belief around anything, fill in the blank, that then causes us to suffer. Whether it's a situation, a person, uh, a past experience. So, when I say that psilocybin can be a tool, I'm really talking about that ability of shutting off momentarily the default mode network. That's a big discussion. So let's just say shut off that automated process. So, brains, we've got neurons. We are really good at creating these very specific pathways of firing, whether they're helpful or hurtful. So, we have a mother that's, controlling, overbearing. And so, when we see our mother, when we see her number come up on our phone or an email in our inbox, that neuron on that we've trained really well to fires until we do something differently, correct? So that neuron A goes to neuron B, that neuron B goes to C, and that elicits physical response, increased heart rate, shallow breathing, clenching of the digestive system, all of these things, whatever it can, I mean, the picture is painted differently for everyone, but this is just one example. So the psilocybin, when it goes in, it gives us a moment of reprieve of that concrete, cemented neuronal network. So perhaps you encounter your mother in a psilocybin session, your neuron A to B to C isn't going to automatically fire. It still might, but it might also typically it will also fire to Z and Q and P. And these allow for moments to think and feel differently about our mother. And in those brief moments where it fires to a different neuron, you can you can have a relief of that suffering, and you can perhaps gain new pathways to fire that you can refer to after the session. And that moment is the relief.
Mm. So if I hear you correctly, what you're saying is something to the effect of like, suffering and pain aren't necessarily the same thing. They're often coupled quite tightly, but
Yes.
there's the painful experience emotionally or physically, and then there's the
Mhm.
response to that painful experience, which could be experiencing pain or it could be
Mhm.
suffering with or from that pain. And it has to do with
Correct.
how we're sort of patterned to respond to certain things that we experience as painful. And that in a psilocybin experience, we have an opportunity to shift the patterns of response to things that we experience as painful, such that we can repattern out of suffering responses and into responses that might be more acutely about just experiencing the pain or the discomfort, rather than getting stuck in a kind of loop that perpetuates in a feedback loop the pain and then the pain of the suffering and then further the pain because it's not processing, because instead of processing we're suffering, and so on and so forth. Is that kind of what you're speaking to?
Yes, exactly, and it's not again, it's not a cure. You're you're probably gonna be triggered again, but again, it's having those glimpses of recognition and that reprieve during the session to hopefully give you enough fodder to move forward, enough, like, to cling to reconsider how you approach this in the future.
Hmm. Let's take a little break from the interview here. I'd like to thank my patrons on Patreon. It's through Patreon that I earn the monthly income that allows me to continue carving out time and financial resources to support this show. Recording software, recording physical hardware, call recording software, memberships for everything these days, hosting and delivery, and everything that goes into making this podcast, interviewing people, finding people, researching, post production, like delivery, promotion. All of it is a one person team. It's me, and my patrons allow me to have that be my job. And I love that. And I'm so grateful. Thank you. The people whose names are listed on the screen here on YouTube or Spotify, or and are listed in the description below are patrons that give of a certain dollar amount or higher, some of which for a very long time, and their name in the credits is an extra thank you for that. If it's your first time listening to the show and you're like, wow, that was great, please consider subscribing. That would be fantastic, or following on your favorite podcatcher. And if you think to yourself, wow, that's so good, I'd like to support the actual capacity to make this show, please consider becoming a patron on Patreon, and making a monthly pledge of even as little as a couple of dollars once a month really does go a long way. And it allows me to continue to invest time and money, cognitive resources into creating this show and to having it be not only my job, but also the thing that I get to do, hopefully, towards creating a better world through the small channel that I have found myself, the small niche I found myself in, which is, of course, like psychedelics. Um, yeah, so links to all of that are in the description to this episode, wherever you're checking it out. You could also leave a one time donation if you just want to send me a sort of like tip. That is much appreciated as well. Tips of a certain dollar amount will also get a call out credit on the show. I think that's long enough for a little Patreon break. Let's get back into this interview with Dr. JJ Purcell. Now, the way this sort of particular scenario, it's described in a very sort of like clean way. I imagine it's much
Mhm.
messier, of
Yeah.
course, in the
Oh, yeah,
actual
yeah,
sort of
yeah, yeah,
the
yeah.
creative mess of the session. Um, and that it is entirely possible that this pain point, we'll use your mother example, the mother thing comes up, and instead of experiencing the suffering, one experiences this different way. Oh, wait, there's all these other ways of being or thinking or relating to it. Now, is it not also entirely possible that let's say that's like pain point to alleviation of suffering, that getting between those sometimes means experiencing quite a lot of emotional discomfort, pain, sadness,
Yes.
grief, maybe feeling all the pain things that the suffering is a consequence of trying not to feel. So it's not this sort of like, oh, I can just not feel the suffering anymore.
No.
Some people have that experience, and I've had it a couple of times, and it's always a treat. But it's definitely not a whole meal. It's not
No.
definitely not what I eat most of the time. Uh,
No.
so I'm curious if you could talk about where this encountering and direct experiencing of discomfort, of pain, of sadness, of things that we generally don't want to feel emotionally,
Mhm.
and how that plays into the alleviation of suffering
So, in the session,
in the
is that what
session.
you're
I mean,
yeah.
I mean it specifically to the session. Of course, this what you're about to describe will almost definitely also could be taken into the rest of our lives, but I mean it specifically in the mushroom experience.
Yeah. So in this example, this very clean version that we're talking about, um, I would say in my experience, at least half, if not more, there's a huge emotional component to almost every psilocybin session that I do. It is uncomfortable. We humans don't want to feel emotion. And there is to some degree a it can be a gentle or a very intense push from the psilocybin to move into that feeling. And my role, again, is to encourage that. That's important. It's kind of why we are doing this work. Because when you allow yourself, so there's two frames of thought, and this is tricky. So here in Oregon, there are a lot of rules about touch for protection, as there should be. Um, and and then California Institute of Integral Studies, where I trained, with Bill Richards and these and Mary, there's a lot of touch involved, and I tend to gravitate towards that touch because being witnessed, being a witness, or sorry, allowing yourself to be vulnerable enough to be emotional, to allow someone to witness your pain I think, hugely healing. So if someone is moving through emotional terrain, whether that's screaming, crying, um, beating a pillow or whatever it is for that person, them knowing that I'm there has, in my experience, always given them the freedom to go further. Versus if they're worried that I'm going to judge them, or I'm standing off in I'm sitting way back in the corner, just observing and not engaging with them. I've seen it be more of a fear to go into the emotion. If I'm like, non-verbally, yeah, do it, go for it. There's a release that occurs. And I do think it's very, very infrequent that we as humans are vulnerable enough to reach those emotional depths of pain in front of other people. And ideally, we've created a foundation of trust where they feel safe enough in order for me to allow them to do it and know that I'm all for it. There's nothing that's not welcome. So whatever needs to come out needs to come out. But I'm also of the background that we stuff all these emotions all over in our body. And until they get released, there's a lot of unwellness that can reside in here. So anything I can do to encourage that person to release, get vulnerable in whatever they're experiencing, I'm going to do my dangest to try to support that.
Mm,
And it's not pretty. It's not, I mean, snot's flying everywhere, and words are coming out that they would never say to anybody most of the time, but they need to come out. They need to be shared and released and gotten out. There's no judgment. This is just trapped, convoluted, twisted pain that's, inside. And if it's trying to make its way out in the session, then it's my job to help that person create a safe space to release it.
mm.
And I don't take anything personal. Has nothing to do with me. It's just the experience that the client's going through.
Hmm. Yeah, this the jumbled mess, the unraveling of those
Mm,
knots, the processing. It's my experience and my perspective is that there's something absolutely wonderful about that, just like straight beauty, that can come from a psilocybin experience, and in different contexts, the joy, the play, the recreation, even all of these things can be wonderful, and they can oftentimes feel extra wonderful if they came on the other side of doing some deep emotional work and some deep sort of
yeah.
feeling work. And that the presence of this kind of these difficult feelings does not suggest that there's anything wrong with the session or anything's
Oh,
going
no.
wrong. I think this is well established now. You could probably see the book behind here, these books that I wrote.
Mm,
When I wrote my first one in 2013, it was pretty common to think that, as soon as anything, quote, bad came up, anything
yeah,
uncomfortable, anything dark, like that means you might be having a bad trip. And a bad
right.
trip is bad. We need to avoid that at all costs. And
No,
my proposal was that, like, no, actually, that uncomfortable stuff, like, that's the good stuff,
totally.
right? That's not the enjoyable stuff. So, like, I can be as open to feeling sad and feeling emotional pain. I could be open to it, but it's not going to be any less pain. The
Mm-mm.
pain is the pain. The overwhelm is the overwhelm. The intensity is the intensity, even if I was ready for it. If anything, I'm just making it not extra, extra by being open to it. I'm
Mhm.
not making it less. And that this is an essential part of what creates the opportunity space for people, which is why I called my book Decomposing the Shadow, a reference to shadow being the dark stuff about ourselves and the mushroom helping us break that down,
Yeah,
liberate it through feeling so that it can then fertilize the choices we make in our lives afterwards, sort of to your change in neural connections sort of example earlier. It can kind of like help fertilize new connections, new pathways in our days and weeks, and if we play it well, months and years following our session.
I mean, that's what mushrooms do, right? They
Mhm.
decompose so they can decompose us too.
Yes, at least most of them, a good chunk of
Yeah.
them. Okay, so wow, mushrooms sound like they're just so good for us. Wow, it just seems like there's so many benefits. Wow, where could it go wrong? Ah, here we are. We're at this point of the conversation. What are the
Yeah.
risks involved? Because I often find that risks, the sort of caveat of risks, they get talked about, but it's pretty minimal. And I get that you don't want to overload people with all the ways things can go wrong. There is such a thing as priming the experience, and that could be counterproductive. Pardon me. But it's also incredibly counterproductive, especially in a kind of movement of wellness and the sort of like social capitalizing, or like the
Mm.
capitalizing, the profiting of social capital in the kind of the marketplace of ideas, the attentional marketplace online of influence and et cetera, to really paint a wellness, goodness picture of mushrooms. It's Lululemon and prayer pose at sunset, and there's not an inch of there isn't the faintest hint of snot anywhere. Um, but things can go wrong, right? Things can
Yeah.
go very poorly and very south for people, even if you're a facilitator, even if everything is, seemingly set up in a good way. It's not a risk-free decision. So I'm curious if you can give us a sense of, like, in your mind, what you see are like the number one risks to keep in mind. Like, hey, even if things seem to be set up to go well, here's some things that could still happen that are, adverse outcomes.
Yeah, I mean, one is and I'm not sure which you're talking about, so I'll just see, I mean, the biggest south for me is when someone wants to leave.
Uh,
They get very fearful, very paranoid, and they're heading for the door. And while we have many conversations about this, prior, it can happen. It's happened.
Yeah, the bolt
And
response, I like to call it.
yeah, the
Yeah.
bolt response is very, very hard because we are, I mean, my like I said, my biggest job is to keep clients safe. So we have to have very clear, and it's kind of like the safety word, and when you hear this word, you have to do everything in your power to pull back in for 30 seconds and connect with me and know and trust based on all the work that we've done beforehand. You got to pull yourself back in a little bit. That doesn't always work.
Hmm.
And it's no fun to have to call 911 and have someone contained. That's not a fun, that's not how you want a journey to end.
No, for you, the
But
facilitator, or for
no,
the client, of course. Yeah.
of course. So that's a horrible one. A lot of people don't understand the physical symptoms that arise. So that can also produce an edge of fear. So whether it's more intense nausea, or vomiting. Again, like vomiting, no problem. Don't worry about it. Diarrhea, no, don't worry about it. Like I've seen it all. Um, and so, but that tends to put people in a less than relaxed state to participate in the journey. Um, we do have to go through mental health checklist. Um, I'm bound now that I'm legal to follow certain protocols. Prior to that, there were certain mental health conditions that I would not run away from, that I still found psilocybin to be helpful for. But you do have to worry about a psychosis state,
Hmm.
prolonged psychosis state after. Um, does that never happen? No, I mean, it does happen. It's pretty rare, but you need to be aware of that risk. And when I say psychosis state, there's degrees of that, right? Some people just have a really hard time feeling like back in their body for a while, a week or so after. Just they just feel a little more disconnected, spacey, and that's challenging, especially if you're walking in a big urban city with a lot of traffic or getting on subways. You want people to be fully connected and grounded back in their body to be moving around the world in a safe manner. And of course, we have cardiac concerns that if you have cardiac disease or certain biomarkers, we have to now do some pretty deep consideration if psilocybin is the right medicine for you to take. So those are kind of the top concerns that I can think of. What can you think of that we should talk more about?
Oh, I think those are pretty good ones. That things might not go as planned, and you might not feel better on the other side of it is another one. Like even if you
Hmm.
don't enter into a psychosis and you don't just end up really embarrassed because you pooped your pants or something, it's like
Right.
you could end up on the other side of it feeling worse than you did
Hmm.
going in. There's no
True.
guarantees. You can
Yeah.
end up confronting things that are well beyond what you thought you could handle,
Yeah.
and it can be extremely difficult. And on the other side, it's just crisis management throughout the course of it, and you're just hoping, as the facilitator, I suppose, just hoping that they're going to be nothing is emergency time, but it's still crisis management. And you're just hoping they're going to be okay, that you can help them be okay afterwards, right? So
Right.
there's also the risk of, it's a minor risk, I think, with mushrooms in particular. And it's not exclusive to psychedelics, but there's always the risk of hallucinogen perception persisting disorder.
Right.
Very small subset of people have it, a smaller subset from psilocybin, but it's not zero, and it can be extremely unpleasant for years or a lifetime afterward. Um,
Yeah, that's where sorry, it's a little tangent, but
get
that's
in
where the
there.
epigenetics piece like really interests me. I think at some point relatively soon we should be able to pinpoint that perhaps,
Mm.
maybe from a gene perspective.
Right, but then we're just going to have to Then it's, well, okay, my next question is going to be about choosing a trustworthy, safe facilitator. And then you add so who's the trustworthy, safe company to hold my genetic data? Turns out it wasn't
Right.
23andMe. Uh,
Right. Right.
Okay, let's take a little ad break here. This episode is brought to you by Amanterra, a credible source for legal psychoactive plants and extracts, most notably the Amanita muscaria mushroom, as well as other plant extracts such as canna, blue lotus, and others. I've personally experimented with the Amanita muscaria microdosing supply that they have, and I had really cool and interesting results that one day I'll make a video about. I've also found their canna extract to be a wonderful alternative for myself personally for alcohol on my nights out and about on the town now that I'm taking a long pause from drinking. Ultimately, I've been very happy with the quality of their products, which is why I've been thumbs up to having them sponsor an episode and why I'm encouraging you now to go check out jameswjesso.com/Amanterra to check out their site and see what they've got going on there. If you use the promo code ATTM22, you'll get 22% off your first order. And with all that said, let's get back into the interview. But yeah, and then there's this other risk, right? Which is that there's always the risk that the person you thought was a good and safe facilitator
Mhm.
isn't,
Yeah.
right? Now, it could come down to them being explicitly harmful, right?
Mhm.
Like harm through uh what is it? There's harms through omission, and then there's harms through active something. They could be someone that actively hurts you in your session when you're
Mhm.
vulnerable. That
Mhm.
happens. It's also
Yep.
possible that you might end up being harmed by the things that they're not offering you, right? So with that risk in mind, as someone who, seemingly endeavors to be a safe and effective facilitator,
Yeah.
how would you what would you suggest to somebody if they were to ask, like, how do I identify that a facilitator is a safe facilitator? Like, I guess the question I'm asking you is, like, what do you see as like green flags? Like, all right, cool. Like, this is a good sign. And what do you see as red flags? Like, oof, if you see that, you should be very
Yeah.
cautious and maybe even,
Yeah.
yeah.
This is tricky because um, there's a wide range of options to take psilocybin. It's a wide range, and there's been cultures and shamans and curanderas who have way more criteria and experience and sitters. I mean, even sitters before all this legalization, that are way more skilled than licensed facilitators. So this becomes a really difficult, and I think I write about it in my book. It's kind of like the wild, wild west. Who do you go see? I don't know. So I think that there are, where someone's offering their services to me is always kind of an important, if it's like in their basement, I don't know. I just think, like, do they have a room, an established room that, they're meeting you in beforehand? Like, you can tell it's already set up, it's geared. I think that's really important. Training, I get really I go back and forth on this all the time. I don't know that training is necessarily like, having the certificate is because I know a lot of sitters that don't have certificates and they're better than the people I've gone to post-grad certification programs with.
I'll
So,
I'll jump in on that quickly. I interviewed Rachel Harris about her book Swimming in the Sacred, and we talked about this to some degree. And the thing was that, like, certification does not mean you're qualified, and you can be
no,
incredibly qualified and have no certifications.
exactly. So, honestly, what I always say is if you can do word of mouth, that is the best way to find a facilitator. If you have a friend or a family member that has seen someone. I myself personally have I have a subset of clients that are more than willing to disclose their identity and talk to prospective clients, because I find client to client communication is really valuable. Um, I mean, anybody can post reviews on a website. I don't find that particularly creditworthy. So, colleagues and previous and past clients, if you can talk to them, I think that's really, really helpful. And then again, other people that you trust that have had sessions that they recommend, other facilitators. Red flags, I mean, again, I don't know that they're sure there's overt red flags I could list off here, but people are really good at hiding those things.
Hmm.
So, and yeah, it's really tough. It can be challenging for sure to
Mm.
find the right fit for you. But for myself personally, you can set up a free consult and I'll talk to you. And I mean, I'm a facilitator, but it's one thing that I do. It is not like my career and like everything for me. And I know a lot of really great facilitators. So if we can have conversations. I talk to people all the time and I give them a list of like 5 to 8 really great facilitators. And then you should be able to have a free consultation with all of them and see what jives and what feels right, and have them talk about their approach and have them talk about where they see clients and their rates. All of those things are important. And I think kind of sussing it out is important before you dive into a session with somebody.
So, if I'm hearing you correctly, I could maybe characterize like a red flag would be someone who is not willing to talk with you
Yes.
in advance.
Mhm.
They're not willing to. Um, that you have to pay to even have a sense of who they are.
Yeah, I don't think
Um,
that's cool, but that's just me.
I would add to this that I would say like a red flag for me is anyone that does not do any medical screening with you at all.
Oh, for sure.
Yeah.
Yeah. They
Uh,
need to they need to be able to tell you how they how they practice, what it looks like, who they are, the structure of how things look. They need to be able to disclose all of that up front.
and they need to be able to tell you what it costs. I think it's a red
Yes,
flag if someone will not be very clear with you around the
yes,
pricing structure of their services.
agreed.
Yeah. Another red flag, I think, and this what I'm going to say here, I think you're going to agree. The red flag here is not about the facilitator themselves or their practice.
Mhm,
It's more a personal thing, which is if
mhm,
you don't feel good about that person,
mhm,
if there's something about them that you're like, I don't feel good around them, or I don't trust them, or something's wrong, right? That might not have anything to do with them whatsoever
mhm,
at all. Could be totally about you. But
mhm.
that is a kind of flag that they're probably not the right person to
Totally
be your
agree.
facilitator.
And that's why those pre-sessions that I was talking that I do, so a lot of facilitators have like a package, right? So this is the package and it includes all of this. So I break mine down. So like you have the pre-sessions and then you have the actual psilocybin session and plus the day after, right? Because that's kind of all that. But these pre-sessions, like at any point, if either one of us feel like, "Wait a minute, something's starting to feel off," or, I don't know, not quite right, they can pull the plug, and they aren't gonna lose a bunch of money, because they've already paid for this session. Like, that is the chance for us to get to know each other. Like, if you don't have some sort of, like, foundational safety trust going into it, then I am probably there's something coming up, and I probably am not the best facilitator for you.
Hmm.
That's okay. That's
Hmm.
totally fine.
Hmm. Yeah, like a great example, I think, would be if you realize that it doesn't feel good to have your facilitator be either the same or opposite gender than you,
Mhm.
right? Like
That's a huge one.
that's a good reason. Or, for example, if you're processing racial issues like sort of racial trauma, having someone who happens by no fault of their own to look very similar to the sort of like, the object of your trauma,
Mhm.
like totally reasonable that that's probably going to make it extra difficult, and that might not be the right facilitator for you.
Yeah. Yeah, exactly. Or something could have been said that just triggers,
Hmm.
if you get triggered, and it could be totally innocuous, like but then that's something to think. I'm I know there's a lot in this kind of field that's like, oh, you're there's a lot of talk of like, oh, you're resisting, you need to push through, you need to keep going. And the pre-sessions is not when you need to do that.
Right,
Like,
right.
you need to trust your own intuition, and you need to honor that, because that's really a good time to listen.
Yeah, the sort of like surrender is for the session. That's
Right.
you should be able to pull out pretty much at any time, all the way leading up until
Anytime.
you've consumed the medicine. At which point, I think safety guidelines should be in place in case,
Right.
right? But at the same time, it's like at that point, you can't just turn the mushrooms off, right?
No.
Um, and something to be said about the something isn't said, right? There's weird feelings. I always, I encourage people generally, like, if that comes up, mention it to the facilitator. Right? You could
Exactly.
just, like, I think that if you have to explain it to your facilitator before they'll sort of like release you from the sort of process, or they're like, oh, yeah, like, you can get a refund up until this amount that you've prepaid if we stop before the session, but you have to tell me why it is you don't like. If it's something like that, then that to me, that's a red
No.
flag, right? Like, you shouldn't
Yeah.
have to explain why,
No.
but there could be a lot of fruitfulness in bringing up what it is, right? And then
Yeah,
how your facilitator responds will show a lot to you about who they are as
for
a
sure.
facilitator, which might actually alleviate some of that. It might have been about you and you needed to say it, and now it actually feels even better than it did before. Or maybe
Mhm.
not. Or maybe it feels worse and you're like, oh no, this person, I'm glad I said something because that was some bullshit what they just said to me.
Right.
Right. So
Right.
um, there's a lot of checking in, what I'm hearing. One way to assess red flags is like checking with how you feel with that person.
For sure. For sure.
So coming into, let's say, the last kind of question I have
Hmm.
is, we've covered a lot about what psilocybin therapy can offer and the sort of like a general look at the way it might go and some of the things that can come up and some of the sort of things that do or do not support it going well, who may or may not be the right fit for you. And so I'd like to end with a question around, how do we know that psilocybin itself is right for us? Like,
Mm.
how do I come to identify that psilocybin is the right course of action for me, or is a
Mhm.
good course of action for me
Mhm.
at what time in my life? So it's double. It's like, psilocybin in particular, and then assessing where it might fit in our lives, the right time, wrong time.
Yeah, I almost think you can have the same answer. But it's like kind of like the law of threes. If you think about it three times, uh-oh, whoop. Uh, if you think about it three times, then give it some good consideration. It's I can say, well, if you're, dealing with a terminal illness and you're contemplating death, that's a great time. If you're dealing with manic depressive and you really are hoping to shed some light on something specific, it's a good time. It's really about when you feel called. I mean, I think that's as simple as it gets. If it's all of a sudden like in your sphere and you keep thinking about it and you're wondering about it and you're curious and you're seeking, potential mental health therapies that might help you along your healing journey, then it's a good time.
A good time
And
to consider psilocybin therapy.
yeah, it's a good
Yeah.
time to reach out to a facilitator and just be like, can we just have a conversation? It's a great time. As far as age, there's no right or wrong age. It's about feeling called and feeling called to action, to want to improve something for yourself. And you're starting to get this inkling like, I wonder if psilocybin can do this for me. And that, like a mushroom blossoms, blooms in your head. And if that keeps kind of, being in your sphere, then it's the right time to perhaps take it one step further. Read a book, contact a facilitator, talk to someone else, reach out on whatever and talk to someone who's been through it,
Listen to a
you know,
podcast with JJ
listen to
Purcell.
a podcast, right? Exactly.
Yeah.
But I really do. I mean, most of the people that I've worked with, that is how it happens. It's like, I've been dealing with this for a while and psilocybin I just kept started to think about it and wonder about it, and that's how I came to do it, and it's like, I think that's again, it's that inner knowing, it's that inner trust, and that's just as much of a part of any healing journey than anything you ingest,
Hmm.
is trusting that inner voice.
Now, I wanna ask you if there's such a thing as the wrong time. Now, of course, if you
Oh,
don't actually
yes.
wanna do it, then it's the wrong time. I think, I had a guest on the show a couple of times now, 3 times, I think. Geronimo MM, he works for iSeers, and, I took a course from them at one point, and one of the sort of things that he mentions in one of the episodes I did with him and in the course, it's like the number one contraindication to taking psychedelics is not actually wanting to take psychedelics, that you're doing it because your spouse asked you, or it's like you think it's the thing you're supposed to do while you're in Peru, or you think it's the only thing that's going to be able to like fix this issue. And so you have to do it, or because it's
Mhm.
trending or all your friends or whatever. Not actually wanting to do it is a huge don't like it's a huge contraindication to having a positive experience. Um, but there's also, we live in an age of influence for better or worse, and
Yes.
it's very easy, I think, for somebody to get to the place where all cylinders are firing, all systems say go towards yes psilocybin therapy, but in actuality it's really a terrible time for that person to have that experience. Can you like unpack that a little bit with me, or for us here?
Mhm.
Um,
Yeah.
why that might be the case and what some examples might be?
Yeah, it's really not recommended to do a psilocybin therapy session or journey in an acute emotional distress. So, and that can look like a lot of things. It can look like you just broke up with your partner. uh, You know, you just lost your job, the death of a loved one. Um, if that is an acute situation happening in your life, it's probably not the right time. You need to move out of that acute distress period, and then psilocybin can be wonderful to help process, those things if it's the thing that comes up for you during that. But the acute distress and upset, can really skew a journey, and make it unproductive at times, just because you're hyper focused on the situation at hand. And so it can overshadow or dominate the experience versus it being a truly interpersonal process.
Hmm. Any other sort of scenarios that you would be like, yeah, this is not necessarily an ideal time.
You mean besides like contraindications?
Yeah.
Oh, I'm sure there are, but what is my brain? My brain is snoozing on what they might be. What can you think of?
Oh man. Well, you're the expert here. No,
I
I'm just
know,
kidding.
no.
I mean,
Far from it.
I'm just trying to like deflect. I guess like
Yeah,
one that comes to mind, and this is not a rule, but generally is like if if things are already in like a state of significant flux,
yes.
that's not a time of like acute processing of an emotional thing, but it isn't necessarily the best time to like add more flux.
Mhm.
With Yeah, like if I was in the process of like packing up my entire house and like not really knowing what's coming next or something, like I probably wouldn't want to have a mushroom journey or try to do any like therapeutic work in the midst of my physical space being all dismantled, for example.
Yeah,
Uh, yeah.
anytime in your life where there is that's more of a time to like have an astrology reading per se. But you know, for psilocybin work, there is a space of groundedness that you should be in. And that's again, that's why acute distress, moving across the country, losing a job, you know, partnership ending, all of these things are just a lot of flux, like that word
Mhm.
that you used, because it's disorienting. It's very ungrounded, it's very unstable. Um, if you've just recently had health issues, again, that's an unstable time. You really do need to reach some quiet, grounded space going into a psilocybin session, so that you can do the work that you're really there to do. Um, because if the mind is in an overly active state, trying to figure something out or solve a problem, that interpersonal work, like much of the time in our life, will probably be pushed down quite a bit. Or it could feel like a very uncomfortable session of this push pulling tension type of wanting to release, but feeling overly mental. And that can be a very uncomfortable feeling in a session. So ideally, you've found the facilitator that works well for you and found the time and space in your life to do this kind of heavy lifting, so to speak, without distraction.
Mm. I think I'd like to add into that as I started to think about the times in my life that, like when have I journeyed when I was in flux or something, and realizing that most of the time it didn't really offer me a whole heap of a lot. But then I was thinking about the difference because I used the example of like moving, and you had used
Mhm,
groundedness. And I think groundedness can mean a number of things. It doesn't necessarily mean that you're in a very stable place in your life. Because some of the most profound and positive long term results, like coming out of the experiences, having really positive long term results from what I got out of those experiences and then what I did with them, is when I had those experiences when I was in a liminal place in my
mhm,
life, that I
mhm.
wasn't
Yeah, for sure.
especially grounded, like, or I wasn't especially stable,
Mhm,
but I was grounded enough in myself and I was in this sort of liminal zone where I could make any given choice. I wasn't in a giant process. I wasn't really in anything. I was just kind of floating in a sort of potentiality of choices, but
mhm,
I was grounded in myself, like I'm in the liminal space. And incredible insights have come out of that for me on sort of the path to take out of that
Yeah.
liminality.
And let me clarify when I say grounded, I don't mean that you need to have your life in order. What I was trying to convey is that you're grounded in the sense of the choice of taking psilocybin and
Mm,
having a session,
right, right.
right? So you've made this conscious connection of this decision versus perhaps you made this choice and then this upheaval occurred, but you've already made this decision, so you're gonna go forward with it. It's more like creating and carving out the time and space to feel grounded in the choice to take the medicine for whatever reason that you're doing versus in a distressed, chaotic, emotional state.
Mm. So before I, get the social media handles and whatever else that you'd like the
Mm,
listeners to leave with, a little talk about purchasing your book, Psilocybin Therapy. I'm curious if you have any one thing you'd like to listen. So let's assume that people who are listening now, they've gone through the whole arc of the conversation with us, and they came in because they were looking for exactly, what it will be marketed as in the branding of the episode, which is a beginner's guide to psilocybin therapy.
mhm.
And here they are at this point in the conversation, just before the conversation closes. Is there any one thing that you would like to offer to that person, be it advice or perspective, or a sort of like a hope or a blessing or anything like this, that you would like them to leave this conversation with, as they step forth into whatever step comes next for them in their process of learning about and deciding around psilocybin therapy?
Yeah, it's listen to yourself and trust yourself. When we do this, we're rarely guided off course. But when we tend, and let me clarify, there's lots of things on the path that look really great, but there's usually only one that feels really great inside. And the more that you can cultivate that connection to that, the more that you can move forward in the world to make the choices that will help you to heal or help you to feel better, help you along your journey, whatever it is. And so, if you're here, first of all, thanks for hanging in to this conversation. But if you're feeling like psilocybin is calling to you, or you're feeling like it might be something of value to you, check in with that, listen to that, and then make your choice based on what comes out of that.
Hmm. Thank you for that. And thank you for this book, Psilocybin Therapy: Understanding How to Use Nature's Psychedelics for Mental Health. Uh, where could the listeners find your book, read your book, and where would they follow your work online?
Yeah, so the book is, through Hachette Press or Amazon or, Kindle. There's an audio, a really lovely woman read it for audio. If you'd like to listen to it, that's great. Social media, please just go to my website, drjjpurcell.com. Um, I'll be honest, I'm feeling a real disconnect with social media. It is not part of my authentic self. And therefore, I believe I will be removing myself from this game that I just no longer wish to play.
Mm,
But I've got a great website and you can email me. I'm really great at getting back to people. You can set up a free consult on my calendar if you want to chat or you have any questions. That's really where I thrive. I just like talking to people and connecting with people. So if that's something you want to do, I'm here.
awesome. Thank you for that, Dr. JJ Purcell. Thank you for this conversation today. I really appreciate your time, and it's been wonderful to talk to you.
Yeah, it's been a pleasure. Thank you so much.
And cut. Well, I hope you enjoyed this interview with Dr. JJ Purcell. Please do check her out through the links that she mentioned at the end of the interview there, which I have included in the show notes, and check out her book, Psilocybin Therapy: Understanding How to Use Nature's Medicines for Mental Health. It's a beautiful book. I really appreciated reading it. I think that you'll find a lot of value in it as well. And also the hardcover it feels nice in the hand. It's nice on the bookshelf. Good to hold. Good to read. Nice if you're one of those bibliophiles like myself, as you can see behind me. I'm a big book collector kind of guy. So if you're interested in supporting me, your host here in the podcast as a whole, you probably heard in the middle there, the show is funded predominantly through listeners like yourself via Patreon and one-time donations. So check the description to find out more about how to do that. And thank you very much in advance for contributing to the cost of the show. You can find me on social media at James W. Jesso in a lot of places. That'll be linked in this as well, in the description as well. But I'm ATTMIND podcast specifically on Instagram, not to confuse it with my personal account, which I don't use for podcast stuff. And then I also have a newsletter. Highly recommend signing up for that. I don't send out very often, but it's the best way to be directly in contact with what I'm putting out. Same with the Telegram, and not relying on algorithms and all the rest of that. So that all said, thank you so much for listening to this episode all the way to the end. There's a lot of content that is just like clawing at your mind, some of which much more manipulative and loaded with stimulus and entertainment right at the front end. The value of it is really loaded at the front end, but like a bag of chips on the other side, fantastic going in, not so good sitting in, certainly not feeling like you're much nourished on the other side. And I try to create something that's more like a well-balanced meal. It's not always the most enjoyable to eat. Sometimes it requires some chewing. Sometimes it requires just accepting that vegetables don't always taste good, but the value of it is in there on the other side, and there's joy that can be found in that. How did I just describe my podcast? I made it sound like it's a challenge, like a grueling, like not 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 broccoli again kind of content. Hopefully you don't experience it that way. Anyways, point is, you listen to this all the way to the end, and I know it requires a lot of thinking to pay attention and follow through, and you did it, and that is no small feat, and I consider it something I'm very grateful for. So thank you very much. And until the next episode, I've been your host, James Jesso. Take care and stay curious.